One of the most common questions that we get in our business is, which is the best supplemental plan? Well, I can tell you that 99% of all people either get a supplemental plan G or a plan N. And so in this video, I'm going to share with you the different costs and coverages of these plans so we can make a comparison. And then at the end, I'll show you what I would do. So G versus N. First off, I want you to know that both plans are great. And really, they're great for 5 reasons. Number one, because you can go to any provider that takes Medicare, whether you have a G or N plan, as long as the provider you want to go to, whether that's a doctor, a hospital, outpatient surgery, or a specialist, or any provider, you can go anywhere that you want, which is truly almost unlimited. Almost all doctors take Medicare. All hospitals do take Medicare. And so the point is, if you have a G or N plan, you can go to any provider that takes Medicare. So you don't have to worry about networks when it comes to G or N plans whatsoever. No HMOs, no PPOs. Any provider that takes Medicare will take your G or N plan. Number two, the second thing I really love about both G and N is that there will be no pre-authorizations that are required by the insurance company. Now, there are some plans that have pre-authorizations, but Medicare supplemental plans are not one of them. Supplemental plans follow Medicare. So the only thing that matters is, does Medicare say they'll cover something and your doctor says you need it, then that's the end of the story. You don't have to have some insurance approval. You don't have insurance interference whatsoever. Advantage plans have that, but G or N will never have that, because if Medicare pays, that supplemental plan has to pay. So again, it's Medicare and your doctor that make the final decisions. No insurance company, no insurance interference whatsoever. The third feature I love about both of these plans is the fact that you have them for life. Once you have we have written, an insurance company has written a Medicare supplemental plan, it is written for life. The only way an insurance company can ever cancel that G or N plan is if you fail to pay the premium. And so as long as you pay your premiums, that policy is yours for the rest of your life. You never have to worry about losing it. You never have to requalify. If you move from one city to another, one state to another, you can take your supplemental plan with you, because they can't be canceled because of relocation. And they can't be canceled because you have a tremendous amount of claims either. Regardless of your claims, that policy will always be enforced. It's not like auto insurance or a homeowner's insurance. If you have a claim, they may cancel you. It doesn't happen that way with MedSup plans. And they also can't be canceled because of age. And so regardless of your age, regardless of your health, regardless of where you live, that supplemental plan will absolutely be yours for the rest of your life. Also, I like G and N because they include foreign travel emergency benefits. If you happen to be outside of the U.S. or outside the U.S. territories, Medicare doesn't pay anything. But both G and N will give you a lifetime benefit of $50,000 for foreign travel claims. And so if you have a claim, you have a small deductible of $250, and they take the balance of that claim, and that plan G or N will pay 80% of the claim, and you have to pay 20%. And again, that's a $50,000 lifetime benefit. And then lastly, I like them because both of them are priced wonderful for the value that you have. All the benefits I just mentioned, no pre-authorizations, no provider networks, you never have to worry about losing the policy. All those benefits are yours, and they're at a very good value. In other words, I think the prices on both the G and the N are excellent. And so those are the 5 benefits that I would tell you are excellent about those plans. And so again, both plans are great. So once we understand that, we also have to know that there are some differences. And so I'm going to go to my board real quick, and I'm going to explain those differences to you. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. Now, when we buy a supplemental plan, what we're doing is we're making the decision that we are going to stay in the original Medicare A and B system, which means that anytime we go to a hospital, we go to a doctor, or any provider, we're always giving them our Medicare A and B card. And Medicare is going to be the first payer, and then the balance of that bill then goes to our supplemental carrier, whatever insurance company you've chosen, that is going to pay second based upon the letter that you bought, again, in this example, the G or the N plan. So again, we have original Medicare pays first, and that supplemental plan is going to pay second. So let's talk very quickly about the differences between the G and the N plan. So let's first off, and let's look at the G plan. The G plan. Now the G plan is going to cover 5 of the 6 Medicare gaps. So on my board here, you can see the different gaps that Medicare has. The first gap we have on the A side of Medicare is the deductible. And so what will happen, the G plan will cover that. The second gap would be if I'm ever in the hospital longer than 60 continuous days, I then get into what are called daily hospital copays. This would be month 3, month 4, and month 5. These don't happen a lot, but when they do, they're very expensive. Okay, and so that's our second gap gap, we have a Medicare hospital copays. Again, that G plan is going to cover those. And then lastly, skilled nursing is also covered by Medicare A. This is when someone's had a stroke, maybe a hip replacement, or maybe an injury or accident or something where they're going to require some intensive rehab. And so the way it works is Medicare covers the first 20 days in skilled nursing, but after that, what we have is we have days 21 to 100. We have to have a $200 a day copay to the skilled nursing facility. And again, right now the average is about 30, 35 days in skilled nursing, so we're going to be out of pocket a few $1,000s. So again, what's going to happen? That Medicare G plan is going to pay all that. So you can see, going to the hospital or going to a skilled nursing facility, as far as anything that those facilities can bill you for, you absolutely have 100% coverage on the G plan. Now, when it comes to the B side of Medicare, so remember what B is. B is going to be everything outpatient related. This would be all doctor services. This would be all surgeons, anesthesiologists, primary care doctors, specialists that you would go to see in their office, or they come to see you in the hospital or skilled nursing. It is the B side of Medicare that always pays the physicians. So we have everything outpatient related. This would be the lab work, doctor services, durable medical equipment, diabetic supplies, oxygen equipment, scooters, wheelchairs, walkers, and all those things are going to be covered by the B of Medicare. All right. And so what's going to happen for the coverage on our G plan, again, we said 5 of the 6 gaps. So the B side, we have the deductible. That's going to be gap number 4. And this is the one item that's not covered by the G plan. You would be actually out of pocket whatever the B deductible is. Then we go, after that deductible satisfied, then we go to our 5th gap, which is 20% coinsurance. And that G plan will cover all of that and with no limit. In other words, that 20% that goes to every doctor, all durable medical equipment, that G plan will pay 100% of your coinsurance. And then if you happen to go to a physician that adds to the bill, this is when a physician adds 15% to the bill. That 15% is called, notice here, an excess charge. And this is a doctor that takes Medicare patients and can bill Medicare legally, but they're not under the contract called an assignment contract, or a participating physician, where they will add to the bill. When they add to the bill, the beneficiary, Medicare beneficiary, you, the recipient, would have to pay that out of pocket. But if I have a G plan, it's also going to cover that as well. And so that's why I'm saying, if we get a G plan, what's happening? 5 of the 6 gaps are covered by your G plan. So when you pay that premium, you're transferring 5 of the 6 gaps to that insurance company. The only one you're responsible for is the B deductible. And that's an annual amount, once a year. So I always tell people the first $226 that's going to be billed to you through this B side of Medicare is going to end up as a bill in your mailbox. That could be maybe 2 doctor visits with some lab work. It could be $226 of an MRI, or $226 of cataract surgery, or whatever. But it's $226. It's once a year. Okay, so that's why we're saying when we talk about the G plan, it is almost a full coverage plan. Once a year you'd pay that, and then every January that B deductible, whatever Medicare establishes it to be, then you'd be responsible for that out of pocket. And then again after that, 100% coverage. All right, now let's talk about the N plan. The N plan is the plan that's going to cover 4 of the 6 Medicare gaps. G covered 5 of 6. N is going to cover 4 of 6, all right? And so the gaps that the N will cover, like the G, would be everything on the A side of Medicare. So again, it doesn't cost you a penny to go to the skilled nursing facility or the hospital. Anything those facilities can bill you for will be covered by your N plan 100%. Over on this side, remember the G plan didn't cover the B deductible, neither will the N plan. You'll be responsible for that B deductible, again, just simply once a year, the first 226 coming your direction. Again, that B deductible could go up, it could go down. It does vary from year to year, but this year, 2023, while I'm shooting this video, is 226. All right, now after that, then we go into coinsurance. And again, just like the G, the N plan will cover that full 20% coinsurance with no limit whatsoever. But here's another place where the N differs from the G, and that is if there was an excess charge that was added to the bill because your physician was not an assignment physician, then that 15% would then be your responsibility, okay? And so that's why we're saying for the 6 gaps, everything covered on the A pays the full 20%, but those 2 of the 3 gaps with the B of Medicare then would be your responsibility. Now, I do want to note this, that excess charges are not real common. They say right now maybe 1 out of 10 doctors on average are going to charge excess, and so most do not do that. In fact, there are some states where excess charges are not even allowable whatsoever, and you'll notice that be New York, Massachusetts, Connecticut, Vermont, Minnesota, Ohio, Pennsylvania, and Rhode Island. Physicians that are in those states that do Medicare are not able to add the 15%. Now, there are some states that will allow excess, but they limit it to maybe 5 or an extra 10%. That does happen as well. But again, excess doesn't occur a lot, and in few states it cannot happen at all. Now, one thing about it, let's say we live in Ohio and we travel to another state to get care because we have to be at some kind of specialty clinic, and then if we're out of the state and that state allows excess, then you could still be subject to that. It just means that the physicians within that state either can't charge it or they can't add the full 15%. All right, so in 42 states, certainly we're subject to excess charges. But again, if it ever happens, it would be out of your pocket on the G plan and the N plan. So as we compare these two plans between the G and the N, what do we talk about when it comes to coverage? The G covered 5 of 6 gaps, and the N is going to cover 4 of the 6 gaps. And so there's one other difference between the G and the N, and that is this. On the N plan, you're subject to 2 different copays. And so let me just write those over here. If you go to any kind of a doctor, this would be a primary care doctor, it could be a specialist, they have the right to charge you up to a $20 copay for their services. If you go to the emergency room, you go to the ER, then you're going to have a copay of $50 as well. So again, we're going to have a couple of copays that are responsible for on the N plan. And again, we don't know for sure what copays we'll be faced with throughout the year. But again, when someone says my plan that I'm going to be on is the N plan, then we know we're going to be subject to what? We have 2 deductibles we're going to pay for, and we're also going to be subject to those different copays. All right, so that's the coverage differences. Let's talk about the cost differences. And again, we're a nationwide broker, so all I'm going to do is just kind of give you an average across the country. I'm going to give you some prices, and you may live in a state where it's a little higher, you may live in a state where it's a little bit lower. Again, these are just averages so we can make the comparison. But right now, that G plan on the average is going to be about $125 a month. And this would be someone that's turning 65. We're going to see a price range of about $125. When it comes to that N plan, it's going to be in the neighborhood of about $90 to $95, okay, on a monthly basis. You can see the difference is going to be somewhere around $30 to $35 a month. And again, some places there could be more, and certainly could be less as well. And so remember, the initial premium is established usually based upon someone's age, their gender, and sometimes their tobacco status whenever they're first turning 65. So it's going to be age. Let's say if someone doesn't retire at 65 and they're going to retire at 67, well, then the rate's going to be a little bit higher than that 65-year-old person. And there are a few exceptions called community-rated states, but the majority of states, when you buy that supplemental policy, it's going to be based upon your age and your gender. But I just wanted to give you kind of a feel. So you can see we do have a little difference in coverage. 5 of 6 gaps covered, N 4 of 6 gaps covered, plus we have a few copays. But again, we're having a difference in premium. All right, that takes us to our final question, and that is, what is best? Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. Now, before I answer the question, which is best, I want to ask you a couple other questions. What is best between Coke or Pepsi? Which would you choose? Which is best, a Ford or a Chevy? Which is best, McDonald's or Burger King? Or which is best, an Apple or an Android? And I know some of you would have answered these, and some of you may have answered those. Certainly, it's going to be mixed. And that's why I want to preface my answer when we talk about which is best. You're going to get a variety of opinions on this. All right, now we already know that both of these plans are great. We know they have the wonderful features of go to any provider that takes Medicare. We never have to worry about pre-authorizations. We have a permanent lifetime policy that can never be canceled other than non-payment of premium. We know we have wonderful premiums, and we also know that we have foreign travel emergency benefits. So again, they're great plans. But which is best? Well, it really just depends on what is most important to you. Remember, we saw earlier, if I have that G plan, I'm going to pay about, on the average, about $125 a month. If I have that N plan, it's going to be about $90 to $95 a month. So what's the difference? Well, maybe $30 a month. And for some people, they're saying that's what I would like to have. In other words, there's some people who will say it's worth it to me to take on the risk of having to pay that excess charge and have to pay some of the co-pays as I go, because that $30 a month or $35 a month premium is more important to me than the potential of excess charges and some co-pays. And so for people who think like that, I would say that in-plan would definitely be the best for you. Now, for some people who say, you know what, that $30 to $35 is not a big deal in my budget, I'm really not concerned about that, I would rather have no surprises. I don't want to worry about excess. If I go to a cancer hospital that more than likely is going to charge excess, I want to make sure that's covered. Or if maybe down the road, 3 out of 10 doctors or 5 out of 10 doctors begin to take and charge excess charges, then I want a plan I know is going to cover that. And so if you're the kind of person like me that says, I don't want surprises, I don't worry about anything other than a small B deductible once a year, that's the plan for me. So you would say, well, then I think I'd like to take the G plan. Again, there is no right or wrong decision here, folks. These are great. These are MedSup plans. They follow Medicare, no pre-authorizations. So both of these are really good. You just have to decide what you're going to be most comfortable with. And for people that are willing to take on a little bit more risk so they can save a little bit of money, then again, that in plan may be the very best for you. Others of you, like me, who say, I don't want surprises. I want to know for sure exactly what I'm getting into. I want to know my fixed costs, which is what I pay my premium, a small B deductible once a year, it's all over. After that, then that's what would be best for you. Okay? And so the point is, both plans are very, very good, and you'll have to decide. The most important thing is to make sure that whatever you decide, that you go with the company, number one, that can service you well. If you use a broker like us, that's going to take care of you and will make sure that you're on the right plan and you're going with the right company. Because not only do I care about this initial premium that we talked about right here, but I also care about the stability of the rates. What's that rate going to look like in 3 years or 5 years or 10 years down the road? So not only do we care about this, but we also care about the long-term benefits as well. And that's why we look at the stability of the rates and the carrier that you go with, because all prices are going to go up in Medicare. That happens with everyone. But some companies tend to take more frequent and more drastic price increases. So we want to make sure we go with a company that has a proven track record of rate stability.